All right, Dr. Limongelli, we talked a lot about gum disease and how devastating the infection in the mouth is. Tell me, when, because the infection in the mouth is not so much about losing the teeth and losing the bones, which will happen and which is bad and which costs money to replace, but at least it can be fixed. It's a mechanical matter, and it maybe looks ugly and all kinds of stuff and costs money, and here and there has a little pain, losing the tooth and going to a dentist and all that. But while this is all happening, a major infection is going on in the body. And that major infection, that yellow, ugly little, pus, which you would have when you have a pimple in the face, or when you have an infection in the toe or in the finger, travels around the body. Why is it that people do not go and fix their infection in their gum as easily? Because nobody would run around more than a day or two with a cut finger or a toe which is bleeding and get infected and putting a dirty sock on it and just let it be there, or a pimple. And everybody does immediately everything to get rid of that infection in the pimple, in wherever it occurs, and yet they don't seem to be doing that in the mouth. Is it not important to do it? Is there a reason why they don't do it? What's the... Shed some light on it.
Well, it's very important, and the process is very insidious. It's not a painful thing, and a lot of patients only come to the dentist when they're in pain. Unfortunately, by then, it's too late to save certain teeth. They wind up with infections in their gums that can cause the loss of a lot of other teeth. And if they have a lot of extensive bridge work or implants or expensive restorations in their mouth, if the infection isn't controlled and cured, it's like building a palace on a bed of sand. All of that can be destroyed in a very short period of time with periodontal disease and bone loss.
Flushed down the drain.
That's right. That's exactly right. To take care of the teeth.
Never mind that while that is happening, you're poisoning your body. Every single minute, the infection which is in your mouth keeps going into your body. And the fastest way, there's no place faster reaching the bloodstream than from the mouth.
That's very true, and it gets into the bloodstream. There's absolutely no question about it. But again, the body has a pretty good filtering system through the lymphatics that filter away a lot of the bacteria, but still some of it gets into the major organs.
Well, why overload them? How many people do you know who cut their toe for whatever reason, or have one of those fungus infections going on, and don't immediately run to the podiatrist and try to fix it? How many you know? They do it right away, right? Within days. They
do it right away because they see it. It becomes a little painful, and they want to take care of it. With their mouth, a lot of people neglect it. They know something is going on sometimes they don't. But even if they do know something is going on, they tend to neglect it. If they take care of their teeth, they go to their dentist every 6 months, get their cleanings, they do their oral hygiene the way they're supposed to, they can get a pretty good handle on the periodontal disease and bone loss, and at least what teeth and gums they have will be in good condition. And then they can take their time with replacing missing teeth and things like that. But they should address that problem as soon as possible also.
Yeah, it makes an awful lot of sense. If it is true that there are babies who are stillborn, not a lot of them, I think 1 or 2 cases so far in California. But if it is true that babies get born underweight, that apparently is frequently happening with pregnant ladies who have gum disease. It's true that that's true, right?
Yes, it is. Absolutely.
So especially pregnant women, it makes sense. Why would a pregnant woman have an infection in the body and right away poison the kid also and be herself, the body being weakened? Keep in mind, a gum disease, of an infection here, it has what, like a half a foot to the brain and a half a foot to the heart? Kind of which one you want it to go?
Exactly. Well, you know, there is a thing called pregnancy gingivitis, where due to hormonal changes during pregnancy, the gums are prone to getting inflamed. But most women who initially get pregnant go to the dentist, get their teeth cleaned, and maintain them. They do very well, and they don't lose any teeth after the pregnancy, which is an old wives' tale, which a lot of women feel the baby took the calcium from my body and I lost my teeth. You know, that's ridiculous. If they take time to go to the dentist every 6 months, maintain their oral hygiene, the gum tissue looks just as good as it did before they got pregnant. And some women feel that when they're pregnant, they can't go to the dentist. They're advised not to do that. Well, you know, maybe they don't get a lot of dental procedures done, but cleanings they can get done, and they can get them done every 6 months.
Right. And let me ask you, sometimes patients, I have noticed by dealing with lots of dentists, so dentists basically tell me that patients come for a cleaning, and then the dentist says, look, your inflammation in your mouth, your gums are in so bad shape, we need to do what's called a deep scale cleaning. Not yet a surgery, but like, you know, scraping in a little deeper. And yes, it costs more money than a normal cleaning, takes a little more time, usually takes an injection where normal cleaning usually doesn't, and then people kind of complain and say, hey, you just want to do I just want a normal cleaning. And I know lots of dentists who, if that stage is there, they refuse. They say, no, dear Mr. Patient, I'm not doing a normal cleaning, because with a normal cleaning, I do not get out your infection. It's too deep under the carpet. Basically, if you imagine yourself, your tooth is a tree, and then you have the ground, and, you know, there's the infection between the ground and the tooth. It's too deep in there. I cannot get it with normal raking. I need to take a little chisel here. And so it just says, and if I don't do that, I'm not getting the infection out. If I don't get the infection out, I actually condemn you to eternal illness. And patients get sometimes upset about that. Did you have things like that happening? Do you have that happening?
Yes, I do. But the patients have to be convinced. They have to be communicated with, and you have to tell them the situation that exists and how it's to be treated. You know, it's not something that the dentist is trying to make money with. If it's warranted, sometimes pocketing or bone loss around the teeth can be shown on X-rays, and the patient would then have something visual to look at. You know, if the gum tissue is puffy and bleeding, all they have to do is look in a mirror and see that. They know that something is not right. They have to be communicated with and convinced that that's what they need, if that's really what they need.
Yeah, because from what I know, there are more or less 3 stages of treating gum disease, depends on how far it is advanced, or 4 actually, if you count the normal, very normal, getting a couple of little food rests out of your thing, which is with flossing and brushing. Then there comes the dental cleaning, the normal 6 months cleaning, sometimes a little more often if needed. Then there is what I just mentioned, the deep scale cleaning, where you guys have scraped a little more, but yet don't call it a surgery. And then there's a full-blown gum surgery, where you really take the knife and you really have to go in very deep, because that usually means the infection is really far advanced.
That's correct.
Am I right there?
Yes, you are. That's the gingival curettage and the flap procedures, where the gums have to be peeled back, and all of the tartar scaled off the teeth, and the granulation tissue which adheres to the inside of the gums curetted off or scraped off, and the gums sewed back again. That's in the most advanced condition, but it does have a very positive effect on periodontal treatment. Does work.
So at whatever stage the person is currently, he obviously has an infection. He's poisoning his body minute by minute. But whatever stage he has, be it a normal cleaning, be it deep skill cleaning or the full-blown, cutting it and putting the gums flopping and back and stuff like that, after it's done, he's clean.
That's right. It all can be treated.
Beautiful. Beautiful. All right. Thanks a lot, Dr. Limongelli. Thanks a lot.
Very welcome.